So moving on, one of the other major themes for this course is homeostasis. To try to represent the concept of homeostasis, I want to show you a quick video of Andy the slackliner. For those of you that are not familiar with slacklining, which I guess is technically a sport, you basically go to a very high up and very dangerous place and then try to walk across a rope without falling to your death. So this is kind of a strange example, I know. I feel like I should give some kind of disclaimer that you shouldn't try this at home, regardless of how stir-crazy you might be going right now. And if you want to see more videos of people doing crazy things, there's a lot of slacklining videos on YouTube that you can check out. But slacklining nicely demonstrates the concept of homeostasis. Homeostasis is the ability to maintain relatively constant conditions. In the case of slacklining, you're trying to maintain relatively constant position in the rope. It's okay if the rope moves a little bit, as long as the slackliner can compensate for it. But if there was too much fluctuation in the rope, then it would be out of homeostasis, and Andy's story would not have a happy ending. Now, it's really because of homeostasis that humans have been able to survive in so many different environments. So temperature homeostasis allows you to survive the 7 months of winter that we have here in Connecticut when it's really cold, and also during our 3 weeks of summer when it's really hot, like right now. But unfortunately, homeostasis is also one of the physiological terms that's gotten hijacked by hippies. So for the record, it doesn't have anything to do with your aura. It also goes beyond temperature. Most biologically important parameters inside the body are maintained through homeostasis. If you've ever had blood work done by your doctor, the report that you get back usually looks something like what we're seeing on the right-hand side. This one specifically is looking at a bunch of different chemicals and enzymes inside of your blood, and most of them appear to be related to liver function. But the idea is that any given biological parameter has a set point or a value at which it needs to be maintained. For example, your body temperature needs to be somewhere around 37 degrees Celsius. But if you look closely at the chart, you can see that things don't have to be maintained exactly at their set point. It's okay if they fluctuate, as long as they fluctuate within a relatively narrow range. So if you take a look at the example creatine, which is a protein that stores energy in skeletal muscle, you can see that its levels can fluctuate within a narrow reference range of 0.5 to 1.6 milligrams per deciliter. This individual being tested has 1.6 milligrams per deciliter of blood, and so they're okay. They're within the reference range. If you take a look at calcium, you'll see the person being tested has 14.7 milligrams per deciliter. This is too high, and they're out of homeostasis, and therefore they're in a state of disease. So I use these examples to show you what a set point is, but also to show you that set points can be different for different biological parameters. You want to have different levels of calcium than phosphorus, and different levels of phosphorus than creatine. Set points can also change. The levels of certain hormones might be greater while you're sleeping than while you're awake, or set points can also shift during puberty and pregnancy and menopause.